friends. Welcome to another episode of the Mama Doc Baby Doc podcast. We're so glad you joined us today. And whether this is your first time listening or you've listened before, I want you to know that we are so glad you're spending some time with us today. My name is Renda. I'm a board certified OBGYN.
And I'm Rachel. I am a board certified pediatrician, and I'm also Renda's daughter.
Yay.
Thank you for listening. Wherever you are listening to us right now, be sure to hit the subscribe button so you can have access to our new episodes whenever they are released.
And today's episode is all about epidural for pain management in labor. Now, I personally have given birth without an epidural for my first delivery. That was Rachel. And I've also given birth with an epidural for all my other deliveries.
Yikes.
Yeah.
I had an epidural for JJ, and that is what I am planning for any future deliveries. It made the delivery process so much easier, and I could really enjoy the birth process and be present for the birth of my baby. In episode 21, we discussed the different options for managing pain during labor. We covered medication-free techniques as well as medical options, including narcotics, nitrous oxide, local injections, and briefly we talked about epidurals. But this episode is a more in-depth look at epidural anesthesia for labor pain management.
And I want to say, before we get into this episode on epidurals, I want to say this. Please remember that there is no right way to manage pain during labor. It is very much a personal choice and one that you have to make for yourself. Today there's just so much out there in the internet about natural birth, and the natural birth movement is growing. And when people say natural birth, they mean an unmedicated birth, because really all birth is pretty natural, right? Yeah. But an unmedicated birth has become more and more popular. However, I want you to know that if you choose an epidural, that is totally fine. And if it's your choice, then it is the right decision for you.
Yes, that's a decision you have to make for yourself. No one else can make it for you. Social media cannot make it for you. Your friends, your mom, your sister, no one else can make it for you. This is your personal choice. And whatever choice you make about managing pain and managing pain during labor, that's the right choice for you. And don't let anyone make you feel bad about whether you choose to have an epidural or not have an epidural. Everyone should just be happy for your choice. And when they say things that are not very nice, just let it slide off your back.
Right.
So let's talk about epidurals.
Okay. So epidurals work by decreasing most sensations, including pain. So it's not just that your pain level will be decreased. You won't feel a lot of anything from a certain level down when you have an epidural in place. It decreases all sensation. That way, that's the way that an epidural works. A catheter is placed in the outermost part of your spinal canal. That's called the epidural space. And by putting the catheter there, it allows for continued or repeated administration of pain medicine. So what that means is that with the catheter there, you can keep getting doses of pain medicine, or you can get a continuous infusion of medication that's hooked up to like a pump. And how that's done varies by hospitals. Different hospitals manage epidurals in different ways. It's dependent on the hospital and also the anesthesia provider, whether that's an anesthesiologist or a certified nurse anesthetist or CRNA. But the big picture is that you will get continued pain relief that's going to last for the entire duration of your labor, no matter how long your labor is, whether it's a few hours or even a couple of days. An epidural can last for all of that time.
Yeah. Now, epidurals, contrary to what many people will tell you, they can be given at any point during labor. I've seen all the things. I've seen women who've gotten an epidural at 2 centimeters, and I've seen them given right before the baby comes out as well.
Right. Right. So like at 10 centimeters, you're completely dilated. I've had patients that have pushed for a while and have just gotten exhausted and then gotten an epidural, and then they were able to relax, and then the baby came. It's not as common to get them when you're 10 centimeters dilated, but it certainly can be done and has been done. There's also no rule that you have to be a certain number of centimeters dilated before you get an epidural. You can get it whenever you want it. It is not about how many centimeters you are, it's about when you are ready to have that type of pain relief.
Yeah, and from personal experience, sometimes when you go in to have a baby and you're in labor, people will try to tell you, oh, we don't usually do them until this many centimeters, or you should really wait longer because of this or that. But that what mom just said, there is no rule.
Right, right,
So
right.
there is no rule. It doesn't change anything. Like, it's not that you can't get an epidural. It's that's just that person's opinion. So
Right,
take that for you will.
right.
And also be mindful that epidurals too do take time to set up. And also, if you're in the middle of the night, your anesthesia provider might have to come from home. So it's not going to happen right away. There's generally about 30 minutes or more of preparation before you get the epidural. And then once you get the epidural, it takes about 20 to 25 minutes for the pain relief to kick in. So you
Right,
don't want to wait too long.
right. And I want to point out that there are also some circumstances where a woman cannot get an epidural. For example, if you have issues with your platelet count, your platelets are the cells in your bloodstream that help your blood to clot.
Yeah.
And sometimes women can have a very low platelet count. And if your platelets are too low, then you cannot safely get an epidural because without those platelets being at the right number, it puts you at severe risk of developing a blood clot around your spine in that epidural space. And that can be potentially very dangerous. Also, if there's something different about your anatomy, so like for example, if you've had really bad scoliosis, if you've had surgery on your spine, or any sort of hardware in your back, then you may or may not be able to get an epidural. You'll need to talk with the anesthesia provider and have a consultation with them to figure out if you're even a candidate for an epidural.
Yeah, definitely. If you have scoliosis or if you've had back surgery, you want to, and you think you want an epidural, please mention that to your doctor so that they can plan accordingly. We can often do an anesthesia consult during your pregnancy to decide if
Right.
you can or can't get an epidural. And then that way you can plan on how you're going to manage pain, if for some reason you can't get an epidural. I know John has told me many times he had to go talk to a patient who had, a tumor and had to have surgery on her back, or had scoliosis, or had a rod put in her back. So they will come talk to you beforehand to kind of, decide what you're going to do. So if you have any issues with your back, you really mention it to your doctor and specifically bring up that you would like to talk to an anesthesiologist during your pregnancy to know whether or not you can get an epidural.
Very good. And also, contrary to popular belief, epidurals do not increase your risk of a C section. When you look at all the research studies, it is just not the case that epidurals will increase your risk of C section. Epidurals do, however, increase your risk of having what's called an assisted birth with either a vacuum or forceps. We don't even do forceps very frequently anymore, but a vacuum delivery. And that's related to the fact that if you have an epidural and you're not feeling the urge to push as much, it's harder for you to push because you can't feel the right place to push. And
Yeah.
then you end up pushing a little bit longer. And the risk of that is not very high. It's only slightly increased risk, but you do need to be aware of that risk. Epidurals will slow down your labor a bit. That is true. They will slow it down, but it's only a short amount. Studies show that epidurals will slow down your labor by maybe 30 minutes. Okay. So it's not going to significantly slow down your labor, and it's definitely not going to stop your labor.
Yeah. And one thing I want to talk about is walking with epidurals. I've heard that I've heard of like walking epidurals. Patients are able to get up and move around with an epidural. When I was in the hospital, basically I was told, you're going to be here for a few days because it's your first baby. So we don't want to give you an epidural too soon because then you'll be stuck in the bed. So talk a little bit about that.
Yeah, well, actually, walking epidural is a misnomer because you will not have enough sensation in your legs to stand up and walk and support yourself with an epidural in place. I don't recommend that. With a walking epidural, they do give you, you do have the ability to move your legs and to change positions really easily. And the anesthesia provider can decrease the dose of the medication so that you're not completely dead numb. We do try to tailor our epidurals a bit depending on what medication they use and how much of a dose they use. And when I say we, I mean the anesthesiologists and the nurse anesthetists, because they're the ones who place the epidurals and control the epidurals. But we can tweak it so that you're feeling some things, but not everything, not the severe pain. You
Mhm.
know, the ideal epidural is when you have pain relief for your belly, for the contractions, which you're going to experience in your belly, but you still have motion in your legs. So you're able to move around, change positions in the bed. We don't want you to be completely numb. Now, some people want to be completely numb, and we take that into consideration, and I'm fine with that if that's what they want. But we don't want you to be in a place where you don't feel anything, because if that's the case, when it comes time to push, it's really difficult to push when you can't feel anything and you have no feedback as to whether or not you're pushing in the right place. Um, so do not expect that if you have an epidural that you're going to feel dead, numb, or not feel anything at all, right?
Yeah, and I had a really great experience with mine. I mean, I've only had one, but I feel like it was a really great experience. It really, my legs felt heavy, so they were like
Right.
harder to pick up, but I could still sort of move them. The nurses kind of helped me when I was changing positions, but I still had somewhat of feeling in them. And then when it came time to push, the doctor who delivered me kind of showed me where to push with her hand. She said, she pushed really hard down there and she said, push right here. And
Yeah.
then I could feel her hand. And so I kind of knew then how to push. So I think that's like ideal, right? Like
Right.
you
That's
don't feel
perfect.
the pain, but you feel like pressure sensation, sort of, so you
Right.
can get someone to help you push. Yeah. So I
Right.
really feel like I had the ideal experience. Um, but also some people are surprised, by the fact that they're not dead numb or even
Right.
upset by
Right.
that if they
Right.
feel anything with an epidural. But like I said, you really want to be able to feel some sensation so you can have an idea of the right place to focus when you push. Um, if you find that when you push and you have an epidural, you can ask the nurses to decrease the dose when it's time to push.
Yeah.
Or they may just do that on their own. So that way, if you really are close to dead numb, they can
Yeah.
decrease for you so you can push a little bit because you do want to feel like pressure sensation.
Right. And I think all patients should go into the epidural with the mindset that you're going to have a decreased sensation of pain, and not necessarily that you're not going to feel anything at all or that you
Yeah.
will never feel a single contraction or a single bit of pain, because that's not the reality. And that's
Yeah.
really not what's most ideal in order to help you effectively push your baby out. Okay.
Yeah, and some people will have hot spots too. Like I know I had a hot spot on one side where I
Yeah.
could feel when the contractions were coming in the one spot. And it still wasn't like, I mean, it felt like little pricklies in that area. It still wasn't pain like it was before I got the epidural. So,
Right.
um, but let's talk about side effects of epidurals.
Okay.
Talk
All
to us
right.
about that.
Okay. So the most common side effect is itching, and it can actually be pretty intense itching. That's
Mm-hmm.
one side effect. Epidurals can also cause some nausea and sometimes vomiting in people. And that's often related to a drop in blood pressure, which we're going to talk about in a little bit. IV fluids prior to getting the epidural that can really help limit that reaction, but nausea and vomiting can be a reaction. Another really sort of odd side effect of epidurals that we don't completely understand, we don't know why it happens, is shivering. And it's this
Yeah.
very intense shivering, even
Yeah.
though you're not cold and you can't control the shivering.
I had
So if
that.
that,
Yeah, it was
okay,
weird.
so I'm going to tell you a trick. If that happens to you, if you stick out your tongue, the shivering stops. I know
That's
it
so
sounds
weird.
crazy. but
Yeah.
sticking out your tongue stops the shivering. You obviously can't just sit there with your tongue stuck out all the time,
We're all like
but
in our room.
right. But
Oh
if
my
the
gosh.
shivering is really annoying, you can just stick out your tongue for short periods to help decrease it. Now, typically, it's going to be more so in the beginning, and then the shivering settles down after the epidural's been in place for a while.
Okay, stick out my tongue. Make the shivering stop. Good to know.
Right. So, another potential side effect of epidurals that I alluded to earlier is that they cause your blood pressure to drop. And when your blood pressure drops, that decreases the blood flow to your uterus as well. And when the blood flow to your uterus drops, that can affect your baby's heart rate. So, a drop in blood pressure can cause you to have nausea and vomiting. It can cause you to feel dizzy or lightheaded. And it can also cause your baby to have such symptoms like the heart rate dropping. That's typically going to happen right after the epidural is first placed when the blood pressure drops. And that's why we like to give you a bolus of IV fluids right before to help prevent your blood pressure from dropping. But if your blood pressure does drop after you get an epidural and your baby's heart rate drops as a result, then the fix is to raise your blood pressure, which we will then fix the baby's heart rate problems.
Yeah, and more fluids and sometimes medication kind of is what is used to bring the blood pressure back up for mom.
Right. Okay, so another potential side effect that can happen is headache. And some people can get a pretty intense headache from an epidural. And sometimes that headache doesn't show up for a day or two afterwards. And sometimes it's even a little bit longer. There are fixes for that too. The headaches are often related to some of the spinal fluid leaking out. And so, one way that we fix that is something that's called a blood patch. The anesthesiologists or the CRNAs do that. But just know that headaches are a potential side effect of an epidural.
Yeah, and the headaches from spinal fluid leaking out are usually pretty severe headaches, and they get worse with position changes. If you think you might have a spinal headache, maybe just chat with your doctor because sometimes, you just had a baby and you're stressed and you're not drinking
Right,
enough water, and it
right,
might not necessarily be from the epidural. It might just be a headache from other reasons. But if you think you might have a headache from a spinal leak, chat with your doctor because the blood patch is something that you have to go to the hospital to get done. And they're usually very, very severe headaches from that.
yeah,
Um, yeah. But another side effect or risk of epidurals is that they may have to be replaced. So
right.
sometimes they
Mhm.
don't last for the full duration of the labor. Sometimes the catheter moves. It's not, I know we've talked about this before, but it's not a needle that's going into your back. They initially put a needle, but then what is left in there is a catheter, a small plastic tube. Um, and sometimes it moves, it's taped onto your back, but you're rolling, you don't feel much. Sometimes it can get pulled out. Sometimes the catheter, when they're placing it, can get bent inside of your spinal canal. Lots of things can happen, and it needs to get replaced during the course of the labor. And sometimes it needs to be replaced more than once. Epidurals can also be one-sided, where you get more relief on one side than the other, and then they can do a little wiggling or maneuvering of the catheter to help make it so both sides are
Right,
evenly numb.
right. And then another possibility, and this is something that people are not always prepared for, and it's pretty rare actually. Sometimes epidurals may not work at all. Now, I've seen this in a handful of people where the epidural gets placed and then it gets replaced, and it never really works very effectively. So those are potential side effects, that it doesn't work at all, that it's one-sided or needs to be replaced,
Mhm.
that you can get a hot spot. I
Yeah.
don't want to scare you off from epidurals by telling you about all those things, but know that epidurals are the biggest intervention in terms of managing pain during labor. And with a bigger intervention, there are going to be some potential side effects. Now, fortunately, these side effects don't happen very commonly, but you do need to be aware of them, that they are potential issues that could occur with an epidural. Now, for some pros of an epidural, number one is that epidurals provide excellent pain relief from labor, right?
Yeah, there really is nothing better, nothing stronger in terms of providing pain relief during labor than a good epidural. There's just no getting around that. The medications that are IV medications or nitrous oxide, they just don't work as well and for as long of a period of time. A great epidural will really give you excellent pain relief during your labor.
Now, another pro for epidurals is that the epidural really should last up until birth. So, whenever you get it, that catheter is still there. You get that continuous administration of medicine. So, it's usually going to last the duration of your labor. The epidural can also be used for a C section if needed. And if it comes to it, you can get a big dose of medicine through the catheter, and it will work during a C-section for pain relief as well. So, also, very little medicine from the epidural reaches the baby. The medicine really stays in around your spinal cord, so very little of it gets to the baby. Whereas, like with opioid medications that we mentioned in another podcast, those do get into your bloodstream, so those reach the baby.
Right. And from the perspective of what's best for baby, an epidural is really great. Nitrous oxide is also really great. And now, if you're using IV narcotics, that's not so great. You know, I've seen babies have trouble breathing after delivery from IV narcotics. So that's not the best for the baby. So if we're talking about what's best for the baby, epidural is perfect. Now let's talk about some of the cons of epidurals.
All right. So, for some of the cons of having an epidural, you are going to be pretty tethered in place, for lack of a better word. There's
Mhm.
a lot of stuff that you're connected to. You will have an IV. You will have to have an IV when you get an epidural because you need those fluids ahead of time to prevent your blood pressure from dropping. You also have to keep getting IV fluids. Another con is that you cannot feel the sensation of using the bathroom with an epidural. Because remember, I said it doesn't just decrease pain, it decreases all sensation from a certain level down. If you can't feel the sensation to empty your bladder, then there's a risk that your bladder can overfill. And you don't want that to happen because if your bladder overfills, then it forgets how to empty itself. And that can be a big problem. So, in order to keep your bladder from overfilling, you may have to get a catheter that stays in place, or every 2 or 3 hours have a catheter put in. Your nurse has to empty your bladder with a catheter. So you are, for the most part, confined to the bed with an epidural. Walking epidurals, again, are really a misnomer. I've never seen anybody that was able to really do it. Yeah, sometimes we can have people get up and transfer to a little commode or toilet right next to the bed, and they can move around and change positions, but you can't really walk. You're just going to be too unsteady on your feet.
Yeah, and also epidurals do require you to have continuous fetal monitoring. The baby has to be on the monitor at all times with an epidural, whereas for an unmedicated birth or nitrous oxide, you can have like intermittent fetal monitoring. And then epidurals do take some time of preparation. Again, it's anywhere from 20 to 30 minutes to get everything set up, get the fluids you need ahead of time, and get the anesthesiologist there. And really, like I said, that's a conservative estimate, 20 to 30 minutes. It definitely could be longer.
Right. The other thing is that epidurals are considered elective. They're not something that's like an emergency. So the anesthesiologist or nurse anesthetist may not be in the hospital 24/7 to place an epidural. That depends on your hospital. Not all hospitals have 24/7 coverage. They have someone
Mhm.
on call, but they may have to come in from home. So
Yeah.
that's going to add some additional time. Also, they may have other things going on. They may be in a surgery. The anesthesia provider is generally going to be responsible for all of the anesthesia procedures in the hospital. So, if there's a trauma, if there's a surgery that's going on, or
Mhm.
urgent cases that are happening, those are going to take precedence over an epidural because an epidural is considered elective. And then the final con is, as I mentioned this before, you may push a little bit longer than if you didn't have an epidural. And that goes back to having that decreased sensation and not being able to really feel everything.
Yeah. Yep. So That's all we have, all about epidurals. Remember to subscribe to the podcast wherever you are listening right now. And we are on Instagram at Mama Doc Baby Doc, and our DMs are open.
So that's it for this episode. Do come back next week and remember that you deserve a beautiful pregnancy and birth. So bye for now.
Bye.